A rhinoplasty is any operation that changes the shape of the nose. There are two ways by which you can do a rhinoplasty. It's either via the external open approach or the endonasal closed approach. The only difference between the two is a teeny tiny incision between the nostrils at the bottom of the nose, which is what I almost exclusively do, given the better exposure, especially to the nasal tip. These scars heal extremely well, they're barely visible once healed, and nobody looks at the bottom of the nose to begin with. There are various ways by which you can do a rhinoplasty. I do structural rhinoplasty. It's like building a tent. We change the underlying framework, and then the skin is like the fabric of a tent that takes on the shape of the underlying framework. So we need grafts, structural pieces, to change the framework of the nose. They're typically obtained from the nasal septum from within the nose. They're always cartilage. If someone had previous surgery or not enough cartilage, then we need backup options such as the ear cartilage, the rib from the patient, or cadaver rib from a donor. The preference for grafting is always from within the nose, meaning from the nasal septum. In primary rhinoplasties, when people didn't have a previous surgery, almost always do we not need to go anywhere else, meaning the septal cartilage within the nose should suffice. Patients who need an augmentation rhinoplasty, like a lot of Southeast Asian patients, African Americans, we have to build up the bridge, oftentimes have shortage of cartilage, in which case we need to use cartilage from a secondary donor site, such as the ear or the rib. A rhinoplasty varies significantly in duration. Primary surgeries, meaning those who never had surgery before, typically take anywhere between 3 to 5 hours. Revision surgeries range from 4 to 6 hours, with very few exceptions taking slightly longer. Rhinoplasty is done under general anesthesia. I do not perform them under local anesthesia for safety and comfort reasons. Patients couldn't even lay that still for that long amount of time. And for safety reasons, it's just always prefer to do general anesthesia. Yes, we do rhinoplasty as an outpatient operation, meaning you do get to go home the same day of surgery. Absolutely. You need a ride for surgery. It needs to be a family member or a friend because you had general anesthesia, meaning someone you trust, who you know needs to pick you up from the surgical center, who should be with you or someone else for the first 24 hours at a minimum. We operate in a surgical center right next door or at the hospital. In both cases, which are fully accredited facilities, state-of-the-art equipment, it is board-certified anesthesiologists who administer the anesthesia. Downtime from a rhinoplasty is about 1 week. Generally speaking, for the first week, there is a cast on the nose and stitches at the bottom, during which time it's best not to return to work. After a week, I take off the cast, and then there is some nasal swelling, generally for 1 month. For that month, I recommend no exercise, nothing strenuous, nothing that makes you sweat, given the swelling after surgery. And people are wedding photo ready, photo studio shoot ready after approximately 1 to 3 months at the latest. The recovery is fairly quick. Most patients take some sort of narcotic pain medications the first night. Everyone stops by day number 3, switching to Tylenol at most. When I see the patients after a week, they discontinued all pain medications, including Tylenol. I would say half the patients stopped medications on day 1, everybody by day number 3. So overall, it's not a very painful procedure, but discomfort does exist and pressure after surgery. Breathing through the nose after rhinoplasty varies from patient to patient. Some people have immediately improved nasal breathing, whereas most patients have some nasal congestion internally, similar to allergies or a cold for the first few weeks. But ultimately, after about a month, the breathing definitely improves, with progressive improvement month after month. So cast removal is after about a week. The nose typically is swollen. There are many factors how the nose looks. You're very presentable already, but it's a swollen new nose. The skin thickness plays a big factor in all of this. The thicker the skin, the more the swelling is and the longer lasting the swelling is. There's a difference between primary and revision rhinoplasties. Generally speaking, when the cast comes off, this is not the day of your best looking nose. There is some swelling there. It takes about another couple of weeks typically for you to feel less subconscious about your nose. And after 2 more weeks, I would say you're ready to engage in social situations, dinners, and other group gatherings. I don't like the term breaking the nose. We make controlled bony cuts. That's not always necessary. No, in fact, in most cases, or I shouldn't say most, in many cases, we don't break the nose. We only do that if the nasal bones are too wide, if the nasal bones are crooked, or if there was a significant hump reduction. But we don't just break the nose to have broken the nose. The black and blue eyes or bruising depends on many factors. The more fair the skin is, the lighter the skin, the more bruising there is. But generally speaking, yes, there is some bruising underneath the eyes and between the eyes for the first 1 to 2 weeks tops. Some people don't bruise at all, others bruise a little bit more. One of the factors is if you do have to make these controlled bony cuts, breaking the nose, then there's a little bit more bruising, but nothing that should be excessive. Skin thickness matters simply because it's the cushion overlying the framework. And during rhinoplasty, we change the framework underneath, but then the skin needs to conform to the underlying shape. Just like with clothing. Thin silk clothing is much more showing the contour that's underneath than a thick winter coat. And so with skin thickness, what matters is if somebody has thick skin and wants a more refined looking nose, we have to maintain the volume to stretch the skin out to actually make it look more refined. So I always recommend to minimize sodium salt intake for the first 4 to 6 weeks to minimize the swelling. A high protein diet is helpful to promote healing. And I recommend no strenuous activities for the first 4 to 6 weeks to help minimize the swelling. For the first 2 weeks, it's for medical purposes, meaning nosebleeds. For the first couple of weeks, there's a risk of a nosebleed during which there's absolutely no physical activities allowed in terms of strenuous activities. After that, it's just to promote the swelling resolution, no longer for medical purposes. Maybe. Postoperative follow-up is quite frequent and regular for the first few visits with me. Some patients I ask to tape the nose at night to help squeeze out the swelling. Others don't need to do that. So it really depends on a case-by-case basis. If we do, we typically start within the first 2 to 4 weeks after surgery, and then we tape the nose usually for 2 to 6 weeks thereafter with frequent monitoring and follow-up. Yes and no. Immediately after, yes, it feels more numb, it feels a little bit tender to touch. In the long run, once fully healed after 3 to 6 months, the nose feels completely normal again like it did before surgery with one exception. The nasal tip is typically stiffer because there is usually some grafts placed to support the nasal tip to have a predictable long-term result. And the tip typically, not always, but typically feels stiffer permanently, but nobody ever is concerned about it or complains about it after. Everything else is temporary. Generally, I don't recommend swimming for the first month. It is safest to swim in a commercial grade swimming pool. Natural bodies of water like lakes, rivers, or oceans should be the last activity to engage in. We'll give directions specifically on a case-by-case basis when one can swim again. It depends. A body bath is completely fine immediately after surgery as long as no rib cartilage was harvested. If we harvest rib cartilage with a small incision below the right breast, I don't want any submerging of the incision for the first 14 days, meaning the first 2 weeks, no bath. scopolamine patch is completely optional. It's one of the measures we have at our disposal to minimize the chance of nausea after surgery. If you decide to use it, place it behind your left ear, not the right ear, the left ear on the skin 12 hours before surgery. So I would just say with dinner the night before, you can place the patch behind the left ear and keep it in place for the next 3 days, meaning you'll be wearing it during surgery and after. The cast needs to stay absolutely dry on the nose, which means don't get it wet with showering, avoid washing your hair, don't let steam build up when taking a shower. No, that's what we are here to do. We come back after 5 to 7 days, approximately 1 week, and we'll take off the splint and the stitches. The first week is the downtime from work. The first month there is some nasal swelling. After 3 months, enough swelling has resolved and the nose has healed enough that your photo studio shoot ready. The question is, what do we consider final healing? The final results we have after approximately 2 to 5 years, depending on the skin thickness, the extent of surgery, but the dramatic big changes occur within the first 3 months. So I would consider the final healing from a social life photo studio shoot downtime for 3 months. General anesthesia is extremely safe these days. We do preoperative testing when indicated with EKGs, chest x-rays, depending on the medical history, the history of hypertension. But once all the clearances have been obtained, it's an extremely safe thing to do to administer general anesthesia, frankly safer than driving home in an automobile. Follow-up is important, especially the first 3 months. Why? Because we can still mold the nose and optimize the healing. How? Taping the nose at night. Steroid injections as necessary to help reduce inflammation, scar tissue formation, swelling. Sometimes I ask for compression exercises of my patients where you 10 times a day for 1 minute each hold pressure on a specific spot, only with my direction obviously. And those things we can do in the early period after surgery. Typically, as a rule of thumb, I see my patients after the first week for cast removal, then another 2 to 4 weeks thereafter, then after another month and another month, then every 2 months and 2 months, 3 months and 3 months, and so on and so forth for the first year, if not longer. For my out-of-town patients, we try to adhere to the same schedule. The first 3 months visits should ideally be in person for the reasons mentioned, meaning we can still intervene with the healing and optimize the healing. And if it's not necessary, we do virtual visits, telemedicine follow-ups, but nothing replaces an in-person visit where I can see the patient myself, put my hands on there, feel the nose. But the first 3 months are crucial. After that, we can space visits out typically, and obviously we have an understanding for our out-of-town patients to minimize the travel schedule and the travel needs. No, rhinoplasty is a cosmetic procedure. However, certain portions of rhinoplasty are often covered by insurance, especially, or not especially, if there are functional issues. If there's nasal obstruction or other issues, things like the deviated septum should be covered by insurance, the nasal valve repair. If you do a turbinate reduction simultaneously, all these things should be covered by insurance. This is a decision made on a case-by-case basis, and we do this pre-operatively to get the appropriate authorizations. Two questions. One, snoring may improve through rhinoplasty if the snoring is secondary to nasal obstruction. Snoring implies mouth breathing, meaning if the blocked nose leads to chronic mouth breathing, snoring may improve. The problem is, breathing at night is subconscious. So if you're used to being a chronic mouth breather, you may not be able to force yourself to breathe through the nose. I would say 2/3 of the patients who do snore and who have nasal obstruction undergoing a rhinoplasty have at least some sort of improvement of snoring, if not complete resolution. In 1/3 of the patients, it makes no difference. The smell initially is impacted through the rhinoplasty simply from the nasal congestion. If you have a stuffy nose, you can't smell very well. Otherwise, there is nothing done during surgery that will permanently long-term impact the smell. If anything, the smell may improve if the nasal breathing improves. So the results are permanent. So they are forever if done the proper way with structural grafting. The revision rate is extremely low. It's not zero, but I think the nationwide revision rate is in the 8 to 12% range, depending if it's primary or revision surgeries. Mine is significantly lower than that, actually less than 1% at this point in time, but not zero. So the results are permanent results. There is nothing such as a maintenance surgery. Revision surgeries are sometimes necessary for various reasons. Sometimes it's just a small tiny little tweak, which we call a minor nasal revision, and that's pretty much the only one I've ever done on my own patients. It never required another full revision rhinoplasty. So I think the two unique rhinoplasties are African American rhinoplasties and Asian rhinoplasties. Thicker skin, usually requiring an augmentation of the nose, building it up for a low bridge and for wide flared nostrils, versus a reduction rhinoplasty typically done in Caucasian, where we want to reduce the size of the nose. And so it requires typically more cartilage grafting, oftentimes rib cartilage grafting, even though it's a primary surgery. So the big difference is the skin thickness, the need for more cartilage, yet the septum usually doesn't give us as much in ethnic rhinoplasties, being more likely requiring a cartilage graft from a secondary donor site. Absolutely, and we commonly do this. You can do rhinoplasty with almost any surgery in the face. I would just be a little cautious with upper lip lifts, because the blood supply to the nose could get compromised if an upper lip lift is done simultaneously. So yes, it can be done even in that scenario, although it depends on a case-by-case basis. Otherwise, you can do a neck liposuction, a facelift, a neck lift, eyelid surgeries, eyebrow surgery, any cosmetic surgery you can think of, otoplasty, in conjunction with a rhinoplasty. I would do a rhinoplasty at least 3 months prior to a wedding to allow enough time for healing, swelling resolution, to look your best, ready for the big day. It depends. Generally speaking, for out-of-town patients, I recommend to stay in town for the first week. Once the cast and the sutures are off, you can travel by airplane again. Plane travel inherently is not more risky or dangerous. The limitation is the strenuous activities. No heavy lifting above 10 pounds, such as carry-on luggage, for the first month, but it's safe to travel after the first week is over. A car ride is okay immediately. When it's a car ride okay driving yourself, I don't recommend driving while you take narcotic pain medications, which usually you're done with after 3 days, so you can safely drive an automobile once the medications were discontinued and you fill up for it, which in most patients is after 3 days.